Good evening, Miss Gretchen. My disease project is on pneumonia, and I'm going to tell you a little bit about it. So pneumonia is an infection that inflames one or both the lungs. It's going to fill the air sacs up with fluid or pus, causing a phlegm and difficulty breathing, along with some other various symptoms. It's going to also constrict the bronchioles, which is also going to cause the shortness of breath and difficulty breathing. This can be caused by a virus, a bacteria, or a fungi. So in 460 BC in Greece, Hippocrates, which was the father of medicine, he described the first serious respiratory disease. 1880s, Carl Friedlander identified a common bacteria strand. 1998, there was a contagious bovine pleural pneumonia, which was a contagious bacterial disease that was affecting the lungs of cattle, which would include like buffaloes, yaks, zebras. And in 1944, Eaton isolated the first tissue culture in sputum from a human, and this was called the Eaton agent. So despite the long history of pneumonia, it's still known very well worldwide and causing hospitalizations and many deaths each year. It's most serious for infants and children, people over the age of 65, and people with weakened immune systems and health problems. It's very serious in crowded areas. This is going to include schools, military barracks, nursing homes, anywhere where you're really close to the next person for when they cough or sneeze, or being close where you can pick up what they're putting down, these bacterias. So the infection tends to occur frequently in the summer and the fall months. And in developing countries, it's very much more prone because of the lack of treatment options, more prevalent disease, and higher bacteria and virus outbreaks. Common symptoms and signs of pneumonia is going to include a cough, fever, difficulty breathing, lots of chest pain, confusion or lowered body temperature in older adults, older than 65. The cough with the phlegm is going to be because of the excess fluid in your lung cavities. The fatigue, the fever, the sweating, the chills is going to be because your body is going to be fighting off this infection. Nausea, vomiting, diarrhea, the shortness of breath because of the difficulty of gas exchange. And in infants and children, they may not show any signs or symptoms, which is a reason why it is a leading cause of the death, because by the time that they get to where they need to go and they figure out what it is, it's already way too late and these children cannot be saved. The incubation period is 1 to 4 weeks. The reproduction is going to be of the disease onto a host cell, which would be a nice warm-blooded mammal like us. It's going to affect the respiratory system, the lungs, which is going to be the alveoli and the bronchioles of that. It's going to constrict the bronchioles using the shortness of breath and fill the alveoli with pus, which is going to affect the gas exchange. The infection causes the oxygen not to be able to get into your bloodstream, and so that's going to hinder the ventilation and cause the gas change and misbalance. So treatment options for pneumonia is going to depend on which type you have, how sick you are, your age, whether you have the prior health conditions, what your overall health condition is. So by the 1930s, there was ways to handle the pneumonias that had been developed. The rates were still high, people being sick, but the mortality rates were dropping because of the development of penicillin. So most bacterial pneumonias can be treated effectively with this penicillin, along with steam showers, humidifiers, and lots of fluids and rest. So most cases can be treated successfully, but it will take weeks to fully recover. So you have bacteria pneumonia, which can occur on its own or develop after a cold or the flu. We have viral, that's an upper respiratory tract. It invades the lungs and it multiplies. And you have fungus, which there's a cryptococcus, which is a certain fungi from contaminated soil and bird droppings. So if you're coming in contact with that, then you're pretty unlucky. So most viral pneumonias are going to be caused by influenza and RSV, which the RSV is the most prevalent in children. The most common cause of bacterial pneumonia is Streptococcus pneumoniae, which is more commonly known as strep. And I have a link right here. It's a video. It's in my PowerPoint, so don't forget to check it out. But because of time and these video size uploads, I'm not going to play it. But don't forget to check it out because I have a video, Miss Gretchen. Okay, so let's see. We have mild cases and severe cases. The mild cases would be more known as like a walking pneumonia, where you're in your house, you can go get your own water, you're able to do some things, but you still need to include some oral antibiotics for the bacterial infections and oral antivirals, which is not going to really cause it, but it'll help it by getting in your body and stopping the multiplication of this virus. Bed rest and lots of liquids. So more severe cases is going to cause hospitalizations, where you'll get these antibiotics or fluids intravenously, and you may even be required to be administered some oxygen. So either way, you need to take your full antibiotic regimen. That way it prevents this disease from coming back and you are able to fully recover. And so even after the bacterial or the infection is under control, you're still going to need to drink lots of fluid and get lots of rest. Avoid public places, avoid smoking, avoid anybody else who is sick, obviously. So you keep it under control with your medicines, lots of fluid, lots of rest, and some time. So like I said, pneumonia is a leading cause of hospitalization in both children and adults. So about 1 million adults do hospitalizations for pneumonia each year, and about 50,000 die from this disease. Over 1.5 million children die of pneumonia, and this is mostly within the developing countries. These developing countries are going to include Bangladesh, China, India, and a substantial amount. Pneumonia is responsible for 19% of deaths in children, and 70% takes place in the sub-Saharan Africa and Southeast Asia. So that's like a wicked lot of little babies dying because of this. But luckily, we have some research people. So we have a research investments in global health study that's hosted by the University of Southampton and it's funded by Bill and Melinda Gates Foundation. And these reports talk about the funding for pneumonia-related research between 2000 and 2015 year. It provides findings for the diagnosis, therapeutics, vaccine research, and they focus a lot on pediatrics, antimicrobial, and high-risk areas. And $3 billion is invested in pneumonia research in 2000 and 2015. So I think that's really cool that we have some nice local Americans that are going to do some help researching for these people on these developing countries, because it is a very serious disease. So I have some resources right here, which most of them come from the web, and I hope you enjoyed my presentation.